Recording again. Live on Facebook. Let's see if the Facebook link will work. Share to a page, share to Alvanley, next. Wonder if this is since we've had the Office 365 upgrade, Catherine, that it's not...
Yeah, because it normally works fine, doesn't it?
Yeah. It says preparing in the top left, doesn't it, on mine?
It's recording on mine.
It's asking me to log into Facebook now.
Oh, heck.
Don't pick your nose or anything in case we are live. I'm going to click a button now that says go live.
Yeah, we're live.
Live on Facebook, here we are again. It's still not saying so on my screen, but let's believe that it's live streaming on Facebook. Thank you all for joining us. This is Friday the 23rd of October 2020, and we're celebrating Breast Cancer Now Wear It Pink Day. So Katherine, you're supporting yeah, I don't know how to describe your scrubs today. A bit psychedelic, a bit 70s print.
I'm thinking CBeebies.
Oh yeah, maybe that's your next career. And so everybody will know Katherine, and you'll know me. I'm Kay, I'm the practice manager. But we're so delighted to have Anna with us today. Morning, Anna.
Anna.
Hi.
So Anna is one of our experts by experience, and in this case, we know Anna wishes she wasn't our expert by experience, but we know Anna's got a really, really good story to tell us about her breast cancer diagnosis. So before we get going, I did this before when we had the women's health session, and I walked around the precinct and I asked people what they call the vaginas. So today I'm going to tell you what people call their boobs or their breasts. So I'm going to go through my list. I hope I don't slip up with any of these because some of them are a bit of a mouthful. So breasts, boobs, jugs, norks, clankers, knockers, boobies, bazookas, busters, melons, jubblies, nungas, globes, udders, bosom, the twins, baps, bangers, fried eggs, Brad Pitts, Pinky and Perky, puppies, spaniel's ears, maracas, fun bags, booze whams, wampers, love muffins, chesticles, breasticles, bazookas, cha-chas, rack, bristols, wangers, wabbers, airbags, hooters, yah-yahs, tartars, aspirin on an ironing board. Can you imagine the conversations I had around the precinct this week asking people what they call their breasts?
That was pretty exhaustive.
Oh, I know, I can't think of any more. Well, I can think of one, but I didn't think I ought to say it live on Facebook because I didn't know who might be watching. So that's kind of cleared up all the embarrassment now. So whatever it is that you call your breast when you come and see us about any breast problems, or you ring up and you talk to our reception team about it, we don't care what you call them. Just ring us if you've got any problems. So Anna, why don't you just tell us your story?
Okay, so I consider myself lucky, actually. Not that I had breast cancer, but it was found so early. There's so many different types of diagnosis, and if you were going to get breast cancer, I got the lowest sort of grade, whatever you want to call it. So I detected a lump just where your bra fit, sort of there, and obviously I did my research and went through a cycle, you know, your period cycle, because obviously your breasts change throughout that, and it was still there. So I booked an appointment at my GP's, and the doctor referred me, and I went to Stepping Hill to have a checkup. They thought it was just like a cyst, you know, they didn't think anything of it, but just to be safe, I went for a checkup. And the way I cope with things, I don't know, maybe like childbirth or whatever, I try and think about the worst case scenario, and then it can only get better. So my husband came with me, and I was saying to him, look, you know, if they say it's a bit of cancer, I have a little bit of a lumpectomy, and a bit of radiotherapy. Not that I'm making that sound little at all, but that's the way I could cope with it. And I was like, it'll be fine. So anyway, we had the checkup, and the doctor straight away said, oh no, that's nothing, that's benign, that lump. He could tell with this particular lump that I could feel that it was benign, but he said, you're here anyway, you might as well go and get an ultrasound. I was too young. I was 36 when I was diagnosed. They said I was too young to have a mammogram. So anyway, luckily I had an ultrasound. The lump that I could feel was benign, but because they did an ultrasound, they actually detected breast cancer, and I had to have a biopsy.
Wow.
So I had a biopsy, which made me worry a bit more. I'm thinking, oh no, they've seen something here, and I had to wait 2 weeks to find out the result, which those 2 weeks were just awful. Just trying to not think about it. We were due to go on holiday, which I think I'll mention a bit later. But anyway, we go back 2 weeks later, and James, my husband's like, oh, it'll be fine, I'm like, well, if it's not, we'll deal with it, whatever it. Anyway, the doctor did say, yeah, unfortunately, we've detected breast cancer. It is the lowest form. We think it's only so many centimetres, so we think that you'll only need to have a lumpectomy and a bit of radiotherapy, which is what I said to James. Don't worry, we can deal with that. Anyway, James was he was devastated. I went into mummy mode where it's okay, I'll look after everybody, it's fine, it's just a bit of a lump. And I think looking back, the way I dealt with it was a bit bonkers, really, because I was just like, yeah, it's fine. And I remember it was a Friday, and we were due to go on holiday the next week, and all I could think of was telling the girls, my girls were 6 and 8 at that time, all I could think about was saying, oh no, we're not going to be going on holiday. And that's all I could think about. Anyway, we didn't go on holiday, and the doctor said, no, you need to come in next week and have the lumpectomy. I was like, no, we're going on holiday.
Oh.
So anyway, we didn't go on holiday, and I had the lumpectomy, and I was due to have radiotherapy. And then the results came back that actually the size of the tumour was too big, and I was going to have a mastectomy. Then that's when it really hit. It really hit then, when I had to, looking at all different mastectomy procedures. So first of all, I was like, oh, just take it off. I'm not bothered. Just take it off. I don't want reconstruction. I'm not bothered. It's fine. Yeah. And then after a lot of research and God knows what, I decided to have a DF flap reconstruction, which is it's a very big operation, but I don't regret it. I didn't want to have, because I was only 36, I didn't want to be, putting things in my bra for that, hopefully I'll live a long life. So we came to that decision, and it was like a 9-hour operation. So what they did was they took, and this was at Wythenshawe, absolutely amazing hospital, they took around the nipple, and they took all the breast out. This isn't technical, by the way, obviously. and then they took the fat from my stomach. Wow. And they took the fat from my stomach and put it into my boob. So I didn't have to have any what do you call it when you you have things implants, those things. I didn't want to have them. I don't know why. I just didn't want to have them because they need replacing and things like that. So yeah, that was a very long operation, but I don't regret it at all. Following on from that, I would have to have tamoxifen because my breast cancer was estrogen fed. So I had too much estrogen in my body, and that's how my breast cancer was formed. There are different types, loads of different types, but this was hormonal, mine. So I began to take tamoxifen, a tablet that stops the estrogen flowing around. Mm-hmm. And then I had Zoladex injections, which Katherine, do you remember giving me those?
Yeah.
You hated it, didn't you? You're like, I'm so sorry.
I suppose that was nothing compared to what you'd had done, was it? And it was an excuse for a catch-up every...
Yeah.
Was it every month or every every month, wasn't it?
Every month, yeah. And then I decided the Zoladex, although it's a fantastic drug, I suppose, to prevent you getting cancer again, I couldn't tolerate the side effects. So I decided to have a full hysterectomy last year. So yeah, that was my diagnosis. So I waffled on too much.
No, not at all, not at all. It's really interesting that whenever we're describing anything about ourselves, I can see you touching yourself as you're describing it. It's funny, isn't it?
Yeah.
And just that fat removal thing. Is there a gap where the fat came from? Did they just suck it out like they're doing liposuction, or is it like a lump of fat that they get out? What's that all about?
So it was like I got a tummy tuck for free.
Winner.
Right, so it's like a bit that they put in, same shape.
Basically, I've got a scar from hip to hip, and they just open up my stomach, get a load of fat, and put it into my boob.
Okay.
So what how do I describe it? I don't know how to describe it really, but it was.
I was just going to say, if you lose weight, Anna, does it lose off your boob as well then?
Yeah, so it's all my own tissue.
Yeah.
But I remember the doctor, he said, "Oh, you're not big enough. You haven't got a big enough tummy to have this done, because you have to be a certain way. If you're too thin, you can't have this operation done." I went, "Oh no, I'm pretty sure I have." and he looks and he was like, "Yeah, right, yeah, we can do it."
What joy, eh? The joy of the belly. Oh, or no belly as the time is now. So you said it was hormonal. Does that mean that it wasn't something that there was a history of in your family? No history of breast cancer?
No history of breast cancer in the family at all, no.
So that, I know you've got 2 daughters, so that must make you feel kind of happier that there's no family history, and you've not got to think about your daughters moving forward. Is that right?
That's right, yeah, but they will be able to be screened earlier, I think from 20, and my sister also has early screening as well. I work with Prevent Breast Cancer in Wythenshawe, a charity, and they've highlighted that the most people that get diagnosed are ladies between 30 and 50. Gosh. But they're the ones that aren't being screened. So we're working with that charity to get that screening age down. So the most important message I want to tell everyone is just to check your boobs. Make it maybe the first of the month. So the first of every month you check in. Get a mirror. I mean, Katherine will go on about checking and things like that, but make sure you do it. The biggest thing was, when I was telling people, was the shock. They're like, "But you're too young." I'm not too young. No one's too young. And the amount of friends that were told me they didn't check, and I was like, you've got to. Yeah. So that's all I want, to get over to people, is you're never too young. Make sure you check your boobs.
And that's one of the reasons we wanted to talk to you today, really, Anna, because we all, we might buy, I was joking to Katherine the other day, there's a packet of pink crumpets in the supermarket I saw, and you see people buying the pink crumpets and you think, well, there, you're doing your bit for breast cancer. Well, you're not, because you're not checking yourself, and that is the most important thing. And as you say, on that regular time each month, we try and do something called Fumble Friday on Facebook, where one Friday a month we encourage people not only to check their breasts, but for men to check their chest, and for men to check the testicles as well. So we try and do a Fumble Friday. So we're all of Woodley and Bradbury are having a fumble on that Friday each month. So I can't begin to think about what that diagnosis was like for you, and what was the kind of standout thing? You when you talked about the holiday and telling your children, I could tell that your voice changed and you went a little bit emotional. Is that the thing?
Yeah, it was the kids, really. I mean, I feel a bit of a fake, really, because my diagnosis was it was always sort of positive in a way. It wasn't like there was, a lot of people get diagnosis, it's like, right, we'll try this and we'll try that, and they don't really know, whereas mine was like quite positive. So, and my father-in-law at the time, he'd had bowel cancer, and so the girls were used to the word cancer, but he was in intensive care and all sorts. So I just wanted to make life normal for the girls. And I had to tell them what it was, but I just said, it's because they were 6 and 8. I said, it's not like Grandad, it's a little bit of cancer, and we're going to cut it out and just make life normal for them. So when I came home and told them, I said, oh, well, you know, I've got this little bit of cancer, but the thing is, we're not going to be able to go on holiday. The eldest one just burst out crying because of the cancer, whereas the youngest was like, oh, we're not going to go on holiday.
Have you managed to have that holiday now, Anna? Have you had that holiday?
Oh, yeah, we've made up for it.
Good, good.
Yeah,
and the girls are okay? They understand a little bit more now they're older?
Yeah, it's funny, because obviously I look a bit different without, you know, with no clothes on, and they're used to it. They're used to seeing that. That's fine. But my niece, I remember she was staying at our house, obviously pre-COVID, and I was getting changed without thinking anything of it, and she was like looking like, oh, that's a bit different. So you get reminded of it every now and again, or if you're getting changed in a, you know, a spa or something like that, I'm a bit more mindful. I'm like, oh yeah, I'll maybe look a bit different. But from the out, like, with not many people see women in clothes on, so that's good. But you wouldn't notice, you wouldn't be able to tell. So
yeah. And that's important for you, isn't it? That's important for you. But I don't think there's any shame in showing your scars either. You know, when you're at the spa, there's no shame, is there, in showing your journey. And you're well now, are you?
Touch wood, yeah, I'm well now. Go for my regular checkups, because my left breast is still my breast, if you know what I mean. So I have that checked every year on a mammogram. So yeah.
So they do a mammogram now. They're happy to do that.
It's funnily enough, they do a mammogram now. Yeah.
You must have hit a special age, Anna.
I have. 40 now.
Yeah, so that's the difference, isn't it? That's the difference. So I'm going to move on to some questions for Katherine as well. But Anna, please do chip in, because you've lived it, so it'd be really useful to hear your views as well. So Katherine, we've talked about Anna and her diagnosis, but I'm really conscious that men can get breast cancer too, can't they? What kind of numbers are there of men?
So the stats suggest that under 1% of men will get breast cancer. So that means nothing to us. So probably 1 in 1,000 men will be diagnosed with breast cancer. But men and women are born with breast tissue and breast cells. So men would predominantly get any issues just right behind the nipple where the breast tissue is. So it's extremely rare, but it can happen.
Okay. So their concentration when they're doing an examination is behind the nipple.
Yep.
I have some model breasts here. So
am I.
Oh, Anna, sorry we didn't provide you with any model boobs. So we're talking about really behind the nipple.
Yep.
Okay. I feel quite comforted to have this boob in my hand. There's something very wrong with me today. Anna talked about her work trying to get the screening age lowered. Can you remind us what the screening is now for breast cancer?
So at the moment, the screening, you'll be called when you're 50 in the UK, and it will cease at 71. And the reason that that's in place at the moment is because they suggest that the chance of breast cancer increases with age. So that's why it starts at 50. And the mammogram, for anyone that doesn't know what it is, it's just an x-ray of the boobs, and you put your boobs, Anna, in between 2 plates, don't you? I've never had one, so you'd probably be better at explaining. So what, you just put your boobs in between the plates, don't you? Yeah.
It doesn't hurt. People think it hurts. Well, I don't know. One at a time.
Yeah, one at a time.
From ladies' feedback, the ladies with the smaller boobs say it hurts because they're squashing down, and the ladies that have got fuller busts say it's all right, actually.
Okay. Right. Okay. So when they're within, and I'm sure it's across the country, within Stockport, our practice gets called every 3 years, doesn't it?
Yeah.
So I think it was last year we had our screening. So there were women who were called that were just less than 50, wasn't there? They would their 50th birthday would fall in the next 3 years. So sometimes you might get recalled if you're kind of 48, 49, but it's around that time. Stockport Council have lent me this, which I think is incredible. I don't know how easily you can see it.
You can see
But
it.
yeah, the bottom bead, so this one here, that is the average size of a lump that a woman will find. So do you know that's really big? That's right.
Yeah.
You know, it's a frightening size, isn't it? So that's what they'll notice. This one is if you're doing regular breast checks, or if you've got a clinician that's checking your breast, but with a manual check, so with your hands. So that's that size. So, you know, big difference. And then this red one here is if you're having regular mammograms. No, sorry. This one here is if your first mammogram, the red one. And then these little ones at the very end are showing if you're having regular mammograms. So the difference is huge, isn't it? So I can see why, Anna, you're keen that women do have the mammogram more often. Amazing, amazing. And that's a little key ring to remind people, you know, what the size difference is. So moving on to what we can do if we're not able to get a mammography. What should we be doing? Anna talked about examining herself. Did you say in front of a mirror, Anna?
Yeah, because it's not just lumps. There's lots of different forms. There's dimpling as well, which sometimes you can't see yourself. You know, you can feel, but you can't see the dimpling. So it's good to check yourself in front of a mirror, so you can check if you've got large breasts. You can check underneath or around the side, and check for the dimpling as well. And if the for if your nipples are going inwards. I can't think of the right
Inverted.
word. Yeah, it isn't just a lump. So I think Katherine will probably be able to talk about that better than me.
Yeah. So go on, Katherine. Tell us about it. How do we do that?
So we talk about self-breast examination, and there's a charity called Copperfield. So it's all about Copperfield when you can and frequently. And it's all about look, feel, and you can add squeeze on. So looking, as Anna said, is inspecting your boobs. What is normal for you? Every woman has got two boobs usually, unless they've had an operation, and one is usually bigger than the other. So you will know what's normal for you. And it's important when you're inspecting that you are in front of a mirror, so your face on and you're looking. What do they look like? Is the dimpling? Is the puckering? Are the nipples okay? Is the nipple wonky? Is it inverted going in? Is there any discharge from the nipple? Is there any pain or tenderness? And it's important that you look like that, but then you also look with your arms up and your arms on your hips. And that's because the tissue could disguise things if you just look in one place. And it's good to do it at the same time every month. Do you know what? It doesn't matter really when you do it, as long as you do it once a month. But we know that boobs get engorged just before your periods, and they change a little bit. So maybe a week after your period is a good time to do it. But the most important message is what is normal for you. Because if us three compared our boobs, they would be completely different.
Without a doubt.
And I think just moving on from that, the squeeze thing you can do, if you have got anything coming from your nipples, like any blood or any discharge, I think you would see it in your underwear. You wouldn't have to squeeze it, but you can squeeze it as well if you want to. And then what a lot of ladies do is when they're in the shower or the bath, they will examine their boobs. So you tend to use your 3 fingers, not 2, because if you use 2, you can squash the tissue and you can think you felt something when you haven't. So 3 is important. And you've got your boob, and you can do, I'll use this one. You can use it in we can do it different ways. So some ladies like to do it as if they're mowing the grass. So let's go down vertically. Some like to do it as if they're mowing the grass, going horizontally. Have you got a horizontal?
I don't think I have. Could I just turn this like that?
Yeah. And then we've got going round in circles. So some ladies, so you can start on the outside and go round. So as long as you're palpating, that just means pressing and checking for any lumps or bumps or changes that are unusual for you. Any altered in size, in shape, that's an important point that Anna's saying. Not only is it your boob, we want you to go all the way up to your breastbone, and we want you to go all the way underneath to your lymph nodes. Because if you've got a breast tumour or cancer in your breast, get involved with your lymph nodes, because that's the nearest, you know, lymphatic system to that boob. So that's really important. So any dimpling, puckering, nipple discharge, altered shape or size or colour, redness,
Katherine,
soreness, rash.
can I ask you about dimpling? Do you mean that it looks like cellulite, that kind of dimpling?
It's a little bit like that. Did I send you a picture of some lemons?
Oh yeah, I'm going to post those after. We're going to have the lemons on
So
after.
there's a really good visual of what dimpling and puckering's like. But the important thing is, a lot of us will have stretch marks around our boobs. We will have maybe little red veins, moles, freckles, and it's all about what has changed for you, what's different for you. Yes, there you go. And with that, the reason why we say arms up and arms on your hips, and then the second stage of the breast examination would be lying flat with one arm above your head. And it's just important to do that, because some of us have got mahoosive boobs, and you will only feel things when you're in a certain position.
Yeah, I suppose if they might not be on the surface, they might be further back. Is that what you mean?
Yep, and that tissue is all behind the nipple and all in that breast. And like Anna said, all the way up here and then all the way under there. Really important.
So 3 fingers, and we're doing it the same time every month, or just as often as you can?
Yeah, definitely just
remember.
once a month. Like Anna says, the first of the month, payday, fake tan night, yeah, whatever you want to do.
Yeah, okay. And what happens if you've got breast implants? How do you check then? Is that different?
So the implants are always behind the breast tissue. So they're either in front of the muscle or behind the muscle, but they're always behind the breast tissue. So exactly the same as if you didn't have an implant in.
Okay, great. So you said there were a couple of other things that you should look out for, and those key things, so we're talking about dimpling, changes to the nipple, aren't we? So inverted or pulled back, or any discharge, any change in colour?
Yeah, so you know, you can get redness, you can get warmth to touch, you can get rashes, you can get sores. Sometimes it's other things, but if there's any changes or any new symptoms, just come in. And just while we're on that topic about coming in, any lady or man who's got a lump anywhere on your body, testicles, breasts, anywhere, then we will bring you in for a face-to-face examination, despite the COVID restrictions.
Yeah, we think that's really important. Not only we know you'll be worried about it if you've got a lump somewhere, but also we don't want to waste time. So we want to get you in as quickly as possible. So we don't want to give you a phone call today and then the doctor say, oh, well, come in on Monday. We want you to come in today. So please don't ever worry about having that conversation with our reception team. And we don't care what you call it, you know, just tell us. So I've got a list of the things that are the symptoms of breast cancer. So I'm just going to read it out, Katherine. A lump, a hard knot, or thickening in the breast. What does thickening mean?
So when you feel your own boob, you will get to feel what it's like, and it's often soft and bouncy. You might get to a point where it's not, you can't press as much as you normally can. It's not as bouncy as you normally can, and it feels like it's just a bit thick or hard. And if you regularly examine your breast, you'll notice that.
Okay. Lump in your underarm area, we've talked about that. Change in the size or shape of your breast. So you might, I mean, it's quite normal, isn't it, for us to have one bigger than the other. And maybe for that to change, can you see how my hands are here? And for that to change during our menstrual cycle as well. But if something grows or shrinks, that's important as well.
Yeah.
Okay. Nipple pain, tenderness or discharge, we've talked about that. What about itchiness, scales, soreness or rash on the nipple?
Yeah, all that. What if there's any ladies watching that want to do more investigation? There's lots of images on the internet. There's typical breast cancer rashes. There's different rashes that can occur. You can get mastitis to your boobs. You can get fungal rashes. So there's lots of resources out there, just so you can look at the image and think, oh right, okay, so I know what that is.
And we'll perhaps, I'll just make myself a note. We'll perhaps put a link on to some of those pictures. And did you say Copperfield was a good website to look at those?
Copperfield is a charity, and it's just
Yeah.
got nice videos, and they have lots of literature. And I think they're quite active in Stockport. I think we've had leaflets in our waiting room
Yeah,
before.
I think we have. And then the dimpling and puckering that we've talked about. And I think you also said breast that feels warm or swollen as well. So that might be a sign of an infection or something. So maybe not breast cancer.
Yep. And you know, some of us are different. Like Anna says, she always thinks the worst. I'm the opposite way. I always think the least thing, and then I'm probably shocked. But we all got different ways of coping. But the slightest thing, don't think, oh, I'll just leave it. It's probably normal. Come in and we'll have a look.
Yeah. Okay. Great. And my next question was, if I found something that I just wasn't sure about, what should I do? And I think we've answered that. Come and see us. Come and see us. Never wasting our. I think if you're worrying about something like this, you're never wasting the clinician's time.
And there's lots of chat and themes on social media and in the news that GP practices are short. We're absolutely not. We're here, we're seeing patients, we've got still the same access. So ring up, breast lump, in straight away for an examination.
Yeah. Okay, and Anna's probably alluded to this as well. The next question is, are all breast lumps cancer? And we know they're not, because Anna went with one that was benign and then just happened upon the other one.
And Anna said that the initial lump that she found was a cyst, and that is the most common reason for a lump. And a cyst is just a fluid-filled sac, but that is the most common reason for a lump. So, and the other thing is a fibroadenoma, that's just a non-cancerous growth. So those two are up there. It's not always breast cancer, it's commonly that.
And I suppose if blokes have the same breast tissue, then they can have those cysts and things as well, can they?
I don't know for sure, but I would think yes, because they've got the breast tissue and the breast cells just the same as us.
I'm just thinking about that panic that a man might have if he feels something. It's not always going to be breast cancer in the same way that it's not for a woman.
Men can also get something called, I hope I'm saying it right, gynecomastia, and that's when their boobs go a bit more booby. So with men, their nipples are quite flat, and that's also something that can be treated. So come in for that as well.
Okay, does that happen? I'm probably asking you too technical a question. Does it happen at a certain time? Is that a puberty thing, or can it happen anytime?
No, anecdotally from the ones that I've seen, it's just randomly 30-year-olds, 40-year-olds.
Okay, sorry for those additional questions, Katherine. You can slap me later. I've got some questions now from patients, and thank you so much to all our patients that are so engaged and asking us, lots of things. Does smoking cause breast cancer?
So all the research suggests that smoking increases breast cancer a little bit in younger ladies. There is a little bit of evidence to suggest that in postmenopausal women, passive smoking, that can increase. I've not seen any stats, I wasn't able to find any, but just to state that it is linked to it. And we know that smoking as well can, so if you did get breast cancer, obviously smoking can increase your risks of anaesthesia, so being put to sleep if you need a mastectomy, and smoking can also impact on your healing process. So if you did need to have a lumpectomy or something. So it's good just to think about your smoking and the benefits of stopping smoking.
Okay. And if you want to stop smoking, we've done a session on that. You can give us a ring and we'll put you in touch with the smoking service. This was quite a specific question we had about one patient's family history, but I think I'll just ask it generally. So if somebody's parent has been diagnosed with breast cancer, well, I say at a young age, and I'm sat here looking at Anna at 36, this was her mum at 55. What should she do in her 30s? What does she need to do?
So I think, like Anna said, there are lots of different types of breast cancer. So it's important that the daughter of the mum finds out what type of breast cancer it was. And if it's a breast cancer that's genetic, family history strong, then there is genetic counselling and there's genetic testing. So it's about going back to a mum's medical team and finding out that information.
Fabulous. Okay. Another person that I spoke to, she said she wasn't comfortable talking about personal things on the phone with the receptionist. Is there something I can say that would mean that they don't ask me lots of questions?
I mean, our non-patient facing, we call it, although they are on reception sometimes, they're trained in this. So they're trained about signposting and speaking to patients on the phone. So do you know what? They have the same rules of confidentiality as the same as the clinicians. So they've heard everything, they're not bothered. But if you didn't want to say the word boob or the word testicle, you could just say you've got a personal matter. But it is good for you to give as much information as you can to our team, just because they can signpost you to the best clinician. We've got a vast array of clinicians now: nurses, advanced practitioners, pharmacists, wellbeing advisors, GPs. So that information is vital for the appropriate person to speak to you. So it's not that they're being nosy and they want to know. We've asked them to ask those questions.
Yeah, I think we understand that people use that phrase, it's personal, but it could be personal that it's a mental health problem, and then we might think about it going to Rod, our wellbeing person, or it's personal, I've got a lump in my testicles. Well, that might mean that we invite you straight down rather than waiting till next week when it might be a female doctor and you might not want that. So there are real reasons behind it. And I promise all of our patients, we ask you and then we forget about it. It's not like we're thinking, oh God, yeah, Steve, what's his name's got this, or Sarah, somebody else has got this. We're on to the next thing, and it's gone. So please, just tell us so that we can help you in the best way. Where are we? Is there a link between taking the pill and getting breast cancer?
So there's two types of pill. There's the oral combined pill and there's the progesterone only pill. So the combined pill has got progesterone and estrogen in it, and it's the combined pill that slightly increases your risk of breast cancer. And the research suggests that if you've been on the pill for 5 years or more, then it increases. Again, I've not got stats or statistics, but the word is slight.
Okay. And estrogen was what you mentioned, Anna, wasn't it?
Yeah, mine was estrogen fed. I mean, the doctor said it was basically because I'm a female. That's why I got it. I mean, I did take the pill for a long time, and there's lots of people that think, there's links between that. But there's lots of ifs and buts, really, isn't there?
Yeah.
So
yeah, the look of the drawer or the unlook of the drawer, I suppose. I think you've answered me this one. I found a lump and he said it was a cyst. What does it mean, and could it turn into breast cancer?
So a cyst is a fluid-filled sac, and no, lots of ladies get recurrent cysts and they're backwards and forwards with cysts, but that doesn't mean you're at an increased risk or that cyst could turn to cancer.
Okay. And a really sensible question, and one that I've not really thought about before. When should I start talking to my daughters about checking their breasts?
So it's generally accepted through all the literature that 20 years old is probably the time when you should start looking. Obviously, there's no harm in looking before. The reason why we don't advocate before is because teenagers are growing and developing and their boobs are changing all the time. So it's good to know what's normal for them. And the literature suggests that by the time they're 20, they know what's normal for them, and then they can check regularly every month as we advocate.
Okay, brilliant. And then one question it's not related to breast cancer, but about breast health. My breasts are not so pert anymore. They get very red and sore underneath. And then she said, and sometimes a bit smelly. Is there something I can buy over the counter?
So sometimes in crevices and creases, we can get fungal infections. So it sounds to me like, say like the boobs, underneath the boobs here, you can get redness. You can get that in your groin. You can get it under any belly folds. So it's usually red, and it can smell, and it can have a watery discharge, and it can be itchy. And we need to prescribe an antifungal cream for that. Usual one is probably clotrimazole, but it does sound like so anywhere that gets a bit warm and sweaty, that can happen.
Okay, can they buy that over the counter? Or do they have to
Don't think they can.
Okay.
It is similar to Caniston that you buy for thrush, but we would usually prescribe the antifungal. And what's good with that is that when you're at home, chuck your bra off, air the underneath of your boobs, wear something loose, keep it nice and dry, and avoid putting any talc or Sudocrem or anything like that. Just let it dry up and go away.
Okay, that's all my questions. So I'm just going to have a look at Facebook and see if anyone's put any other ones in. Oh, somebody says you're a very brave lady, Anna.
Oh, you are, Anna. And something else that I've not said, Anna, you know, the decision you made to have the reconstruction, that decision wasn't a light decision because it's a massive operation and it's left you with a massive scar. So that must have took a lot of turmoil for you.
Yeah, it did. I was like saying, oh, what if something happens in the operation?
Yeah.
And I die because I'm vain. And actually, I'm not that vain. You guys know me.
Have we lost Anna? Have we lost her? I think she's gone.
She's froze.
She has frozen.
She
Let's
might
see if
come
she
back.
comes back. The next question was, my age group wasn't shown how to check and it was hidden away in the odd leaflet that was given out at the clinic. So hopefully we've described it well enough. What I'll also do is I'll find one of those Copperfield videos so that we can show how you know, we can really show how to do that examination for you to go and have a look at those. Are you back, Anna?
Oh,
she's
back.
Hooray! And we've had 196 people watching us this morning, so isn't that incredible? And
did I go?
You did go, Anna, sorry.
You're back now. Oh, she's gone.
She's gone completely now. Oh, bless her. And all I was going to say was thank you to her because, you know, it takes some bravery to, well, to go through what Anna's gone through, but also to be so generous to share her story as well, so honestly. So thank you to Anna. Thank you to everyone for listening. And Katherine, as always, thanks for your honesty and kind of indulging me a little bit, being able to do these sessions to help our patients understand a little bit more about what will happen, what might happen to them if they find anything.
And please send any more questions if people watch the video after. If I don't know the answer, we've got senior clinicians. So yeah, ask away.
Oh, I'm back, I think.
Oh, you're back, Anna.
We were just saying thank you to you, Anna.
Oh, you're welcome.
Thank you for sharing your story.
Again, we've got Anna's email address. So if you've got any questions that are specifically for Anna, so if you're sat thinking what kind of reconstruction should I have, you know, how do I deal with this talking to my children, if Anna is very generous with her time as well, and I'm sure we could put you in touch with her. Are you nodding, Anna, or have you frozen again?
Yeah, of course, yeah.
All right, thank you so much,
no,
ladies,
I'm nodding.
and take it easy and enjoy wearing pink today.
Thanks, Anna. Thanks, Kay. Bye, everyone.
Bye.